few more minutes. Notice there's just a few minutes. We have 20. Go ahead and get started. I want to recognize we have George Phillips with us. He is with Just in Time Moving and Storage, and he is our co-host today because he knows how to do Zoom better than I do. And he's my right and left hand for this meeting. So George, you want to tell us a little bit about yourself?
Yeah, how's everybody doing? I would much rather be able to drive up to Northern Arizona, but happy to do it in this fashion. George Phillips with Just in Time Moving, and we move folks. Usually, most of our moves are local here around the city in the Phoenix area, but we do quite a bit go up to the Northern Arizona, Tucson area. So we're all over the state. And we do long distance moves. So those are done on a dedicated truck with a dedicated crew. So I appreciate you guys having me. Thank you very much.
Thank you, George. We appreciate you. And of course, we have Robin Valentine on with us today. Many of you don't know Robin or haven't seen her before. You've maybe talked to her on the phone or received emails. She lives in the computer and in the telephone, but today we have her also on our screen with us. Robin, you want to say anything?
No.
No? Okay, great. So I hope everybody's doing well. It's definitely a challenging time, and there's never been a better time for us to stay connected. So this is a wonderful way to do it. So welcome to our very first Zoom Northern Arizona Spotlight event. We do have a good program planned for you today. First, we do want to hear from Brandon Baxter. He's with NACOG Area Agency on Aging. Brandon.
Thank you very much, Kyle. Robin, great to see you. I don't get to see people anymore, so this is a nice pleasure. Just figured out how to get my camera to start working on my iPad within the last couple of weeks. So the first 4 weeks at stay at home, and I was just hearing people's voices. I was leaning my head out the window, shouting at neighbors I'd never met before. Hi, what's your name? Probably the friendliest crazy person they've ever met now. We at Area Agency on Aging, NACOG, have been working hard for about 6 weeks now. We've been working from home remotely. We've hit the ground to keep all of our services up and running and modify which services that couldn't be done in person, which has been challenging for some of our programs, but quite enriching and probably pushed us forward in how we're able to deliver service content moving forward, especially for the socially isolated. Some of the changes that we've seen happen are directly associated with the CARES Act. We have additional emergency funding that has come down through from the federal government, now dispersed to the states, and we just got the federal funding alert now within the last couple of days. It's going to allow us to really ramp up home delivered meals to the 60 plus people that are socially isolating due to concerns over COVID-19. So we want to make sure that people are aware that if you have a 60 plus individual who is socially isolating over concerns related to the pandemic, they don't even need to have activity of daily living impairments. They can receive up to 2 home delivered meals per day. So that's 14 meals per week, every week. Delivered right to their home, which is really going to help with some of the food insecurity issues. We are actually getting a lot of phone calls from people saying, I don't have food. What do I do? I'm running out of milk, of things to eat. And within the next couple of days, I'm going to be in a real predicament. Give us a call. The 1-877-521-3500 phone number is the central intake and referral phone number that we say is our no wrong door point of entry. Go ahead and direct people to that phone number and we can get them signed up for these home delivered meals, so we can all try to navigate this time a little bit more safely from our homes and limit our exposure, especially in grocery stores, as much as possible. Some of the other things that our senior centers are doing is, because the limitation of how many people can be in one given place at one time, they've cut back on what we would call congregate meals, and now they're doing meals to go and curbside assistance from many of our centers. So people can still show up, get their hot meal and another meal to go with them at most of the centers in Northern Arizona, and that way they're not missing out on that opportunity for that hot, nutritious meal. We've had to make some changes with some of our formatting of our family caregiver programs. We have support groups throughout the state that meet either weekly or bi-weekly. Everything from Alzheimer and dementia groups to basic caregiver support groups to kinship caregiver support groups or grandparents raising grandchildren. We're now making the switch to have those available online. So they're virtual now. People can log in from their home and take place whenever they want to. Just sit in, log in, talk to us, share your feelings, so you still have that outlet. One of the things we've noticed with family caregivers is they typically don't give themselves enough breaks as it is as they move forward. So we want to make sure that they realize you can still give yourself a break, even if you have to go into the next room and have some peers to talk to about some of the challenges that you're facing with the new shelter-in-place orders. What are you doing to try to stay engaged mentally, emotionally, socially? What are some of the tips and tactics we all, as your peers, have to share with you about how to overcome some of these obstacles, and maybe even find ways to be able to get out and have a little picnic if it's possible, if it's feasible, even in your backyard or someplace safe, so you can still get the sunlight, the vitamin D exposure, and try to keep your mental well-being up. Some of the wellness checks that we're doing now, we've identified hundreds of clients that are at risk of social isolation, and we're calling them 2 times a week, making sure that all of their needs are met, identifying any needs that might arise that we can meet either through programs of our own or through referrals to the nonprofit or for-profit organizations that we work with, namely you. So it's been business as usual in a lot of the ways for our information and referral team, because we've been able to get those phone calls sent directly to their homes. That way, the voice over internet doesn't really know where you're physically sitting. It's able to direct the phone call right to our information and referral technicians. They're able to access our databases and give out the same level of service that we were before. So we're grateful for the technology in that way. We're staying in contact with people who are been involved in our health and wellness programs. We're doing some of the videos online now. We're posting to our website, nacog.org/aging. You can find some of our content. There are also links for nutrition guides, exercises, way to stay healthy while we're isolating in place. It's very important to keep that mind-body link. We're also continuing to do our Medicare and public benefits calls. Our counselors still are taking all of their Medicare to You calls. They're still doing the senior health insurance patrol. They're doing the Medicare patrol. So any questions you have about your coverage or your public benefits, please give us a call. We are still taking all of those questions and still helping people with their different concerns, whether they have a bill that they think they should not have been billed for according to their Medicare coverage. Give us a call. We'll help you with that. As a matter of fact, our team is really good with appeals. They're winning them left, right, and center. So if you have a client that's in need, they feel like they need some assistance with their public benefits, have them give us a call. We can help. The Ombudsman program has had some challenges entering some of our long-term care facilities, but we are still doing visits remotely using technology and as necessary in person, following proper PPE protocols, making sure that we're not bringing anything into the facility and or carrying anything out. So the long-term care ombudsman team is very busy, mostly with issues of access for family members to be able to meet and interact with their loved ones, finding a way to make that happen in a safe environment, and making sure that the voice of the residents is not lost, that their concerns, they still have an outlet to express those concerns, and that we can still advocate on behalf of them and their families in this difficult time. They're very busy with these new rules and regulations in place, and a lot of people feeling as though maybe their access to their loved ones has been unduly limited. So we're working with the facilities and the residents and their families to make sure that everybody is well and healthy, but still has social interaction opportunities. When we take a look at some of the things that we continue to do with our care coordination and reassurance specialists, we have called over 400 of our clients to sign them up for additional meals to make sure that not only are they getting the one home delivered meal a day, but that they have access to the additional meals now that their ability to get out and about has been even more limited than may have been before. We're also taking new calls. We're getting an additional approximately 538 additional calls last month alone related to the COVID-19 questions, supports, and services and what we're doing. So our phones are ringing probably at a rate higher than ever before, which is great because, as you well know, if we don't utilize these supports and services, there's very little chance that they'll continue to fund these supports and services. So access to these services is still there. We want to drive people to that 877-521-3500 number so we can continue to fully utilize all of the available supports and services to keep people healthy, active, and engaged in their communities. Ways that you can help. There are a lot of people who are calling saying, what can we do to assist in these troubled times? I will tell you that we are utilizing people who have a level 1 fingerprint clearance card already in hand to make wellness calls to our clients to identify any unmet needs so we can go ahead and rally supports and services to those individuals in need. We're also directing other people who want to volunteer their time to their local food banks, to their local Meals on Wheels centers, and to their local nonprofits. So if you are a nonprofit or an organization that is looking for more volunteers, reach out to me at my email that I posted, bbaxter@nacog.org, and send me your contact information because I am getting a lot of people reaching out daily for volunteer opportunities, and there's only so many that we can onboard at any one given time. So I'm looking for organizations that are looking for more volunteers as well, and I'd be happy to direct them your way. One of the things I just want to let people know is we are still all working full-time. We are all essential service providers here at the Area Agency on Aging. So while we may be working remotely, while I may not get to do some of these presentations and trainings in person, we are still working full-time to meet the needs of the communities. And we're here still to be a voice for you and your clients. So if there are any needs that are being unmet right now within your communities, we do have some more flexibility with this CARES Act money that we did not have previously. There are, so to speak, fewer strings attached with many of these funds associated with the COVID-19 pandemic. So if you have unique needs that are coming up and you think, well, there's no way they're going to be able to meet that need, that's not necessarily the case. Reach out to me, find out what the need are, and then we can try to game plan a way to identify the different pots of money that could be available to overcome these obstacles and impediments. The word of the day is creativity. We are trying to be creative to make sure all the needs are being met. We may not be able to meet them all, but with your help, identifying where those gaps in care are, I'm very confident that we can meet most, if not all, of the needs that we're able to identify. So without any further ado, I'd like to turn it back over to you if you have any questions for me specifically.
Yes, wonderful. If you have a question, just go ahead and unmute yourself and ask Brandon.
Hi, Brandon. It's Robin.
Hi, Robin.
So good to see you. I've talked to you over the internet for so many years. I'm excited to hear all the things that you shared. I don't get to be at the event, so this is all new information to me, and I love it. I'm really eager to connect with you and to find out more about how I can post this information for you online on our website, including posting the event, the meetup groups that you're doing. I'd like to know when those are, and also finding out about these videos that you guys have going.
Great.
These are all things that I can put on the website for your organization and help get the word out. So I'll connect with you. Okay.
Great.
Thank you.
Brandon, I did have a question about the online support groups.
Yes.
Is that something that people have to register for? Do they do that online, or
yeah? So
intake number?
all they would need to do is they could either do it one of 3 ways. I'll give you 3 ways they can do it. They can reach out to our toll-free number, 877-521-3500, and tell them that they would like the login information for the caregiver support groups, the virtual caregiver support groups. They can email me directly for their request at bbaxter@nacog.org, and I will get that information to them. Or they can reach out directly to our family caregiver coordinator for any questions related to the family caregiver program. Her name is Emily Jarrett, and she can be reached at ejarrett@nacog.org. I'll spell that. That's EJARRETT@nacog.org.
Awesome. Thank you.
You're welcome. Thank you. Ever feel like Ben Stein in Ferris Bueller's Day Off? Bueller. Bueller.
Any other questions for Brandon? Okay.
nacog.org/something.
Oh yeah. The website is www.nacog.org/aging. But if you get to nacog.org, we're one of the big divisions right there on their website. So you'll be able to get to us off the landing page too.
Okay.
Okay, great. Next, we'd like to hear from Comfort Keepers. We're very happy to have Julie Bailey with us today. Julie.
Actually, it's going to be Cindy Harris, the owner, who's going to do some talking today.
Great.
I'm passing her the mic. Maybe she is.
Are you there? Can you unmute yourself?
Kyle, who was it again?
Cindy.
Cindy.
Cindy with Comfort.
It doesn't say I'm muted.
There we go.
There you are.
There we go.
Did you hear it?
Just now.
Oh, okay. I was going to say it doesn't say I'm muted. Earlier it said you muted me. Somebody over there did. Well, for us, life has changed quite a bit, but we've continued to be there for our clients, and we've just implemented more training or made everybody retake training such as infection control, which encompasses, of course, hygiene, PPEs, all that. And we're wearing masks and things to our clients, but we're still trying to keep their life as normal as possible. We're taking the risk for them. So if instead of taking them to the store now or running errands with them, we do it for them. So we really haven't been impacted as far as any loss other than normal loss, which is, you know, either folks dying or going into the hospital. We have continued to stay in contact with our clients and our caregivers daily for some, weekly for others. Really haven't had a whole lot of change. The office actually is still up and operating in the office. The office people are still here. We've just asked our caregivers not to visit us because they're going to expose us, or we're going to expose them, whatever. But we pretty much, life is pretty much the same except with extra precautions. So I don't know, we're still doing intakes. We're still getting new clients. I think we've taken so much precaution and so much training that everybody seems to feel comfortable. The caregivers feel comfortable, the clients feel comfortable. I don't know, Julie, do you have anything to add?
I think the only thing I have to add is that I am so thankful for the company I work for and how well and how professionally we have rolled out the issues that have gone on, because it seems like not our caregivers nor our clients have any panic whatsoever. They're really happy at how well we're reaching out to them and how well we're taking care of them. So I commend each of our caregivers that are out there every day helping our clients. They've done really well with the situation going on. And I'm really thankful, like I said, to have a company that's helped make sure we are using the right precautions, making sure we're taking masks. We're contacting them, like she said, daily or weekly to make sure if any resources, anybody needs them, we have them and ready to go. Other than that, I think that's all we've been facing. We're pretty much normal business as usual for us.
The offices in Scottsdale are working at home because they work in a big facility, or their office is in a big facility. Other than that, they're the only ones working at home. I don't know if anybody has any questions for us, but that's us.
Cindy, Julie, it's so good to meet you and see you online. This is Robin. I am interested to know if I can help you in any way by posting any videos. Have you guys created any videos that you'd like me to place on your website page that are just something that people can learn more about your services and see, like an online tutorial for them to listen to?
Absolutely. I have a few that I could give to you. I will
Okay, that would
talk
be
to
great.
Cindy and we'll email them to you.
Okay, sounds good.
Awesome.
And then if you have anything else going on or on the horizon that you want me to post, just reach out.
Perfect. Thank you.
Terrific. And that goes for all our advertisers with us. If you have a video of a virtual tour, something that we can put on our website, we would love to do that. That would be included in your advertising rates with us.
Even PowerPoint presentations I can put on.
Okay, great. Thank you, Cindy and Julie. We appreciate it. Any other questions for them before we move on? Okay. Next, we want to hear from Good Samaritan Society. We're very happy to have Travis and Kelly with us both. So, hi, guys.
Hi, how are you guys doing? So Kelly and I have been working from, well, our office, the home health office, has been working from home now for, a little while.
Forever.
The week after spring break. And we've been doing a lot of our weekly, like, transitional care planning services over the phone, so that we're not adding additional traffic in and out of our rehab facilities. But yeah, really the key for us has been just flexibility, making sure that everyone's able to adapt to the changes that we've had to make over the last couple of weeks, or almost a month, well, more than a month now, isn't it? So for the home health side, it's really been threefold. We've had some changes in our response to the referral sources that we've had. So we've noticed a real increase in the acuity of the patients that are going home from the hospital. Patients are going into the ER, or they're having surgery, and instead of keeping the patient there in the hospital, patients are wanting to go home right away. And so we've had to see patients that have a little more clinical demands, and tried to adjust that a little bit. Yeah, so that response has been all about communication, making sure that we're communicating well with our referral sources, and so that we understand the actual needs of the patient, so that we're better prepared at home, helping the patients there. And really that leads to our second point of change. Is our clinical staff has been amazing and just really hit the ground running. They've adapted to all of the needs that we've had, as far as the PPE needs, the daily screenings of both themselves and the patients that they're seeing. And we've had really good guidance from our corporate office, who's really been on the front lines of the policy and procedural changes and recommendations actually set by the government. Our clinical directors for Sanford and Good Sam were actually invited to the White House to help make policy changes and give those recommendations for the things that we're seeing now nationally and through the states. So on that end, we've been pretty fortunate, and sometimes feels a little bit more aggressive than what we're feeling compared to other agencies here in the state. So when dealing with the hospitals or other rehab facilities, our guidelines from National Campus have been a little bit more restrictive than others, and so that communication part really has been key for us. But yeah, just to highlight some of the things that we've been doing, every day our clinicians report into the office whether or not they have any symptoms, whether or not they've traveled or been around people that have traveled, or whether or not they've been in and around patients that are tested positive. And then every visit that they make, they're calling ahead of time, asking those same questions, treating every patient at the same way, with the same level of dignity and respect that we can. But they're all wearing masks, they're all practicing good hand hygiene. And then our administration staff has been really flexible, working from home. We have one nurse that's stationed at our office there all the time. And his job there is to just kind of manage our supplies, make sure that our clinical services are up and running and have the tools that they need. And so that we're not we're kind of keeping our contact with one another limited. But I've been really amazed to see the flexibility that our staff has had. We started, I think, on the 20th of March. It is April, isn't it? And in about a week, we kind of settled into a good rhythm, and we're able to make sure that all of the pieces to our referral processes and getting authorizations and making sure everything's scheduled and making sure that patients know that clinicians are coming out. All of those pieces had to get kind of reworked with our new coworkers, our kids and our partners that are here at home. And it's been kind of like starting a new job, but doing the same tasks. So it's been interesting to do that, but it's just amazing to see the flexibility that we've had. Yeah, those are kind of some of the changes and the things that we've been doing. Overall, our census actually decreased a little bit because the hospital's been a little bit lighter, and our rehab centers are not taking as many patients. But we're looking forward to having that census grow back up again now with the elective surgery starting back up here in a few weeks. Now I'll hand it over to Kelly because her side of things is a little bit different from us.
Yeah. Can you guys hear me? Much like Travis said, it's been kind of challenging. We tried to keep as many people out of the office as we can. And our Marley House, which is our inpatient hospice unit, instead of offering our 5-day respites to not only our hospice patients and the other community hospices, we have restricted it strictly to what we call general inpatient, so that we reserve the 10 rooms to the most critical needs for our families in the community. And also we're just really trying to keep everybody safe. So, typically we would have respite patients there for up to 5 days, and their families could come and go and visit them. So by kind of limiting it just to our general inpatient folks, we're restricting the number of people coming in and out of the Marley House. Probably the most challenging thing for us is we've got almost 40 hospice volunteers, and they can't go out to visit their family, their patients, and keep them company and just do what they normally did. So what I love that we're doing right now is a project called 1,000 Hearts. And I'm going to try and get all techie on you here. And I don't know if I can share my screen, Kyle. Is that okay if I try this? Oh, I can't hear you.
Sorry, I have to unmute myself. I'm
Yeah.
not sure how we're set up with that.
You want me to try?
You can try. See if that's
Okay. I've been doing a lot of Zoom lately. We do our morning meetings every morning by Zoom. So I'm going to see, nope, I can't do it. But what I love is we've got what we call a drive-through Monday, Wednesday, and Friday at 10 a.m. And we go out there, our team that's in the office a little bit, our volunteer coordinator, me, some of our nursing staff, if they're there. We have all these craft projects. And so our volunteers come through in their cars and they hand off what they've made for us. And, you know, we give them new projects if they want to work on them. Our volunteer coordinator called around to all the assisted living facilities and group homes and other organizations, not just the Good Sam ones, and found out there are about 1,000+ seniors who are pretty isolated right now because they can't have family come see them, they can't have visitors. Even our hospice staff, you know, a lot of the facilities just really want to limit it to the really most critical folks coming in. So, excuse me. So our chaplains and our social workers are doing a lot of their visits via the phone or through Zoom. So our volunteers are making these projects and then we're bringing them out to the different facilities just to tell the seniors in our communities at our assisted living facilities and at our group homes that we're remembering them and that we love them. So what I've loved about this is it's really grown as a program. We've got some of the local church groups coming out and making pictures and painting rocks for us. And I wish I could show you some of these photos, but we've gotten some really sweet projects. And then we sanitize them, wrap them all up, put them into containers, and deliver them out to the different facilities so that they can follow their protocols for making sure things are sanitized. And then they deliver them out to the residents in the group homes. So it's just been a way for us to kind of keep active, keep connected with the community, and keep sharing that, you know, we're here and we love everyone and we know this is a tough time for everyone. So I've been really grateful to see the turnout. We've gotten some local church groups involved now, and we even have some AARP volunteers who are coming through on the drive-through to make projects. So I know, Brandon, I think you talked about volunteers. So if there are people that are feeling crafty and want to take home some projects, we've got lots of projects. And I wish I could show you what our office conference room looks like, because it is like Hobby Lobby just threw up in there. It is crazy looking in there. So luckily we aren't meeting in there right now, but we've got lots of stuff going on with our goal of trying to deliver at least one project a week out to the various 1,000+ folks out in the community. Our chaplain is also trying to do some devotional stuff online, and he is, if you've ever met Adam Bissell, he's a wonderful guitar player and singer. So he's been doing some I guess, song recordings in our chapel, and we're trying to put that on YouTube, and we're kind of pushing our technology limits there. But we also Skyped our harp player in, and I was able to record the Skype session. So that was kind of fun too. So we're hoping to get that YouTube channel up there. So folks that want to hear some old timey music or some hymns or some harp music, we want to make sure the community can have that and listen to it. So that's what we're doing. Any questions?
Yes, I have a question.
Sure.
I'm just wondering, when you talked about that online chapel thing, is that something that we could do at our community on Sunday?
Yeah, I think Adam is actually going to start recording some devotions. So I will send you the YouTube link. I mean, it's going to be obviously a recorded video, but he's talking about doing like maybe a 10-minute thing and doing one of those a week. So yeah, definitely. And I know he knows your residents there, so that'd be super cool. He also has about 30 minutes each of, like I said, those old time hymns and the old time music he likes to play. So I'll make sure to send you guys or send out the link. So you guys are free to share it with your residents or families if you want to. It's a lot of fun. I end up singing You Are My Sunshine in my head for like hours after trying to go through these tapes.
I will say too, one of the things that we've done just in trying to make sure that our office is running smoothly and more or less the same as what we had done before, is instead of having specific Zoom meeting times, right? So like everybody jumps on at 10 o'clock and then they have their one meeting. We've actually been able to keep our Zoom meeting open all day. And then our administrative staff just jumps on and off of that. They'll share their screen back and forth. And it's basically like being in the office and just sharing that space to bounce ideas back and forth with each other, or just to have an extra voice in, to be able to talk to. And it's really helped being able to, or needing to work from home and having that isolation that's a requirement, but being able to kind of communicate and have those conversations. So that's been really helpful.
Yeah, I walked in when you guys were doing that in your office, and I can't remember who was at the front desk. They're like, "Hey, you want to say hi to so and so and so and so?" And I'm like, "What?" And she turned the screen around, so I got to wave and say hi to some of the nurses. That was very fun.
Okay, well, any other questions for Kelly or Travis? All right, well, thank you guys. We really
Yeah,
appreciate
you bet. Thank you.
and all of you. It's a unique time, and we're here to help any way we can. As you know, our digital edition is online, so families can see the Spotlight Resource Guide that way if you can't hand them one or send them one. It's a great way to find it there. Does anybody have any announcements they want to make to the group? Now is open to do that. So just unmute yourself and make your announcement.
Hi, Denise here at Glassford. Just letting you know we are taking residents. We're keeping our residents safe, and we do have a studio apartment available if anybody knows anybody that needs assistance.
Hi, it's Leah from the Peaks Health and Rehabilitation and Senior Living. I just wanted to let you know that even though we are under Fort Knox lockdown, we are taking some admissions and so residents on the assisted living side. Of course, there's a lot of hoops you have to go through, but we are there. If there's anyone out there that you hear needs help, we do have beds available on both sides of the building.
Good morning, everyone. Nancy Winters with Legal Shield and ID Shield. Just wanted to let know I see a lot of our members on the line now, but our law firms are staying open through all of this, and they are taking several calls right now to update wills, power attorneys, get all that estate planning documentation in order. So they are available for you if you have any questions on that. I put my information in the chat. Thank you.
Anyone else want to take a moment to say something? We want to make sure everybody has an opportunity to express themselves.
Good morning, everybody. I'm sorry.
No, go. I just want to say it was fun to see everyone's faces.
Yes, it really is. I have my camera turned off because I've got an issue in the background here, so I just left it off. But this is Nancy Bowers. I'm the Director of Allied Health at Yavapai College. And I just wanted to let everybody know that we are doing the best that we can to work with our state boards of nursing and the NCIA board to continue to offer our nursing assistant training and our caregiver training programs. Because of the social distancing, we needed to delay the clinical portions of our of a couple of our programs. So we're finishing up skills labs this summer, and we'll be following the rules of social isolation and infection control. And we have plans to go ahead and continue those programs in the fall. So if you have individuals that need to have training, send them our way. We're doing the best that we can to keep you staffed well. And then those of you that do work in long-term care, if you're out there, we really appreciate it that you host our students when you're able to, but we fully understand when you're not able to. So our hearts are with you, and we can't wait to come back and see everyone again. So thank you.
Anybody else? All right. Well, thank you everybody for attending our first Zoom Spotlight for Northern Arizona. We will be doing these monthly now, so on the fourth Tuesday still of every month. Look for our newsletters. And Robin, do you want to say anything before we end the meeting? Okay. Well, thank you.
Sorry, I was unmuted. There you go. I just wanted to say I'm here like I always have been to serve you and help you in any way. So if you guys have events that you're starting to do online to reach out to people, please let me know about those. I'll be happy to post those for you and help you in any way I can. But it's great to see you guys all.
Wonderful. Thank you, Robin. And thank you, George Phillips, again with Just-in-Time Moving and Storage for helping us today, co-hosting this Zoom Spotlight with us. And you all be safe out there. And again, if there's something Rob and I can do for you, please let us know. Thank you.
Bye, everybody.
Thank you.
Bye.
Hey, have a good day.
Thank you.
Bye.
Bye-bye. Thank you.